Are you having inflammatory arthritis like rheumatoid arthritis? Then most probably during this monsoon season, you are experiencing more symptoms. But no worries, there is a way out. Hi, I am Dr. Pradeep Kumar Shenoy, India's first DNB consultant rheumatologist, addressing you from Amrita Center for Rheumatic Diseases in Mangalore. In rheumatology, we have two types of arthritis, that is inflammatory arthritis and non-inflammatory arthritis or degenerative arthritis. In inflammatory arthritis, we have rheumatoid arthritis, which could be seropositive or seronegative. Then we have seronegative spondyloarthropathies like reactive arthritis, ankylosing spondylitis, psoriatic arthritis, and enteropathic arthritis. Degenerative arthritis or osteoarthritis mainly affects the knee and the hips. And in inflammatory arthritis, there will be pain, swelling, and stiffness, which typically lasts for more than 1 hour in the morning. Whereas in degenerative arthritis, pain, swelling, and stiffness typically lasts for less than 45 minutes. In inflammatory arthritis, when the joint is put into motion, pain decreases. Whereas in degenerative arthritis, the pain increases. In inflammatory arthritis, pain and swelling will be equal in proportion. But in case of degenerative arthritis, there will be more pain and less of swelling. Now, let us come to the point why there is more symptoms during rainy seasons in inflammatory arthritis. That is primarily because during rainy season, ambient pressure and temperature comes down and humidity, damp and moisture increases. This makes the tendons, ligaments and the muscles attached to the joints tense or they become tight. So this causes pain in the joints. For the same reason, the synovial fluids within the joints, they become thick. They contribute to the stiffness. So this is the reason for increased pain and stiffness that is experienced in the inflammatory arthritis during rainy seasons. And if there is dehydration, that is, if the patient is not consuming or drinking enough water, then again the synovial fluid can become thick and it can contribute to stiffness. Now, let us discuss about the way out. So, if you are being sedentary in rainy seasons, do aerobic stretching exercises. This will help the mobility and the drainage of synovial fluid. And if you are having only rheumatoid arthritis and not seronegative spondyloarthropathy, in rheumatoid arthritis, only aerobic stretching exercise is sufficient, whereas in seronegative spondyloarthropathy, along with aerobic stretching exercises, the patient has to do low back exercises and spinal extension exercises. Then, as I said before, after the exercise, make sure that there is adequate consumption of water. The trick is that during rainy season, one may not feel thirsty. So go by urine output. Make sure that you pass adequate amount of urine. So this prevents rehydration and you can also make the synovial fluid thinner. And after doing this much, if you are not feeling better, make sure that you are following up the doctor's prescription rigidly. What I meant to see is that pick up the prescription and see that you are following the doctor's prescription, your rheumatologist's prescriptions tightly. If not so, please revise yourself. Make sure that you are consuming all the medications as per the doctor's directions, as per the prescription. Now, you can use clothes to protect yourself from cooler atmospheric temperature. This will significantly help you to decrease the symptoms of inflammation. And you can use hot water bags and you can keep it on the painful, swollen, stiff joints. This will help to decrease the symptoms, that is pain, swelling and stiffness will come down. Then you can use NSAID gels on the painful, swollen, stiff joints. You can use it thrice daily for 2 to 3 days, and if the symptoms are not coming down, then you can use a painkiller. Maximum of 5 painkillers per month you can use. Then, if you are not feeling better despite all these measures, you can consult your rheumatologist again. He might either increase the dose of the existing drugs, or he might add new drug to the existing regimen. That will help you to go ahead. Now, there are other concerns. If you are already on disease modifying anti-rheumatic drugs in rheumatoid arthritis, these drugs decreases the immunity. So if you go out in water, there can be fungal infections within the web spaces, that is the space between the digits. So this is called as tinnipedes. So please avoid going out in the rain. And infection can flare rheumatoid arthritis or any inflammatory arthritis. So please avoid going out in the rain and getting drenched. This could precipitate viral infections. Please don't eat from outside, because this can produce gastroenteritis, which can subsequently precipitate reactive arthritis. And all other measures, including taking care of the water in the well, this will help not only you, the entire society. And if already there are deformities which is already developed before consulting a rheumatologist, in India it's quite common to go for alternative system of medicines like homeopathy, Ayurveda, Patanjali, Siddha, etc. So we lose the window of opportunity to treat the patient amicably. So some patients come to us with deformities. That is why I said, if you have already deformities, try and avoid slippery places, because you might slip and fall, especially if there are deformities like hind foot valgus, you may not be able to balance. And if you fall, if the arthritis is already there for long number of years, there will be coexisting osteoporosis. And if you fall, there can be fracture. So take all these things very seriously and practice it very vehemently, so you can survive this rainy season amicably. Thank you. Next time in my video, I will discuss about fibromyalgia and how to cope up fibromyalgia during rainy seasons. Please do follow me. Thank you.